These are the incisors. This is the canine. These are premolars. The molar is one little tiny thing back there. This little, the carnasial teeth, one's inside the other, just like scissors, so it cuts muscle and bone into little pieces. So you can see the sharp edge there, the sharp point there, and the sharp edge here. And here's the other carnasial tooth that fits inside it. They work like a scissor. Sometimes as they chew hard things happen to the teeth, like hard baked bones can cause it, rocks, metal, hard plastic. This will happen. The tooth has broken off, and here is the pulp cavity right there. That is where the nerve and the blood vessel come in to nourish the tooth. So this carnasial tooth or premolar has been broken. If we leave it in, sometimes the infection will go up into the root, and then we have a root abscess called the carnasial tooth abscess, and it will make an abscess right here. I'm going to first loosen the tooth, loosen its attachments to the gum and the bone underneath with my tooth loosener.
It's actually called a periosteal elevator, and I stick it underneath the gum like that, and it'll get bloody because I'm loosening the attachment of the gum to the tooth so I can start taking it out.
Yeah, I'm giving myself a shower, but actually that is the water used to cool the drill as you drill into the tooth. The enamel and dentine are very tough. That's why they can chew through bones. And we can use this little drill. And remember that noise? Does that make you feel good? Does that make your teeth hurt? It makes mine hurt, and I'm doing the surgery.
The water that's coming out of the drill is used to cool down the drill so it won't burn the sensitive tissues that I'm working on.
Now that I've cut through the tooth, I'm going to loosen it up by putting this loosener, I know the real name honestly, but I'm not, why barrage you with terms? I'm going to use this to loosen it up to see if that first segment will come out.
After I cut the tooth into sections, I try to use the elevator to loosen the tooth by putting pressure on the teeth but into the crack and loosen the attachment so I can pull it out.
So I've pulled the first root out. See how nice and rounded the tip is? That means I got the whole thing. That's what we want.
Right down the middle, because the front half has two roots and I have to get them both out. Then I use the elevator to pry down the crack that I just made with my drill, and then I use the tool to grab that section and pull it out, root and all. Comes out pretty easy, doesn't it?
Here's number 3. 3 strikes, you're out.
You can see the big hole in the back and 2 holes in the front where the roots went in that big premolar or carnasial tooth.
So now what we're going to do is we're going to sew the gums together best we can, because as a dog eats, it'll jam food up in those holes, and that's not a very good thing because it'll start infection.
After I take the tooth out, there's the holes that were left from where the roots went in, and what we want to do is suture the gums together so that infection can't get in, and so the holes are covered. We use absorbable sutures, which will stay in the wound for a few weeks until they dissolve, and it'll keep everything all together so that it will make a nice little barrier. So I put several sutures in, and you can see the wound is getting closer and closer together and covering up the holes that were left from the root.
So that hole now is sewed up by the gums of the tooth and the hard palate, which is this. But you can see there's the molar, there's one premolar, there's the canine, there's all the incisors, and that's where that carnasial tooth used to be, right there.
It's Profi paste, nice raspberry scent, very nice. After we have scaled the teeth with an ultrasonic scaler, it leaves small scratches in the outside of the tooth within which bacteria can get into and multiply, causing much of the bad breath and plaque to come back that we just went ahead and used all this time and money to get rid of. So we're going to brush this on here. This has a nice fine grit to it, so it'll go ahead and polish off all those small imperfections in the outside of the tooth that I just talked about. Now that we got the prophy paste on the teeth, we're going to go ahead and take the polisher here. You should be all familiar with that from the dentist. You go in and you want to go on top of the teeth, and this here has got a nice little texture in it that's going to take that grit paste and it's going to polish it to a nice, clean, shiny surface where no bacteria can get into.
Now Buddy's waking up, so we're gonna... Buddy, are you waking up? Look, his sun's flopping around, he's waking up. So we're gonna take the drinking tube out. Oh, boy, it's a long tube, isn't it, Buddy? He's got a cage with a little towel and a heating pad. So, all except for the tooth extraction, the rest of the experience has probably been pretty good. So now Buddy's looking at us kind of wild-eyed because he can't keep his balance. Huh, Buddy? Hi, Buddy. This is about an hour after surgery and you're looking around now. You kind of got the head, you're not got all your fine motor skills, which means you kind of jerking around a little bit, but you're pretty with it, aren't you? Yes, sirree. Hey, Buddy, how you doing? How you doing, Buddy? You feeling better? I'm sorry I took your tooth out. You know what? You'll thank me later. You're gonna go home in a little while. You're a very good patient. You're a good patient. Okay, thanks, Buddy.
Buddy's broken tooth, removing it wasn't a real hard task, but it was pretty technical. I hope you enjoyed it. It did give you the heebie-jeebies too much, like a trip to the dentist always does. But dogs can break their teeth by chewing really hard bones. Some dogs can't. Some dogs that are chew too hard on the really hard-baked bones you get for the pet stores or steak T-bones can break their teeth. But in my book, Dog Dish Diet, I talk about the type of bones that you can use to have dogs chew on because it's really good for dogs to chew. It takes down tartar and makes their teeth and gums really healthy. So if you're interested, check out my book, Dog Dish Diet, at dogdishdiet.com. Here's to chewing.